So let me tell you a little bit about alkaptonuria. It's called black bone disease because the cartilage and connective tissue and bones turn black because of the accumulation of a particular substance called homogentic acid. But it's really rare, so it's considered to occur in probably about 1.25 million births in the United States. And that means that there'll be about 1,000 individuals in the United States with this disorder. And the defect in this disorder is that the patients are unable to break down a chemical called homogentic acid, or HGA. And the body produces homogentic acid from tyrosine, which is one of the 20 important amino acids that makes up our protein, that makes up the protein of our body. And the protein is turning over constantly. So that means that there's a constant production of tyrosine itself, and then the breakdown products of tyrosine, including homogentic acid. And when this starts to accumulate, its breakdown products bind to connective tissues. That's ligaments, tendons, cartilage, bone, etc. Turns them black and destroys them. So this is not diagnosed in newborns at the current time, but you'll see in a minute that it can be diagnosed sometimes in infants. The patients are generally diagnosed in adulthood when the tissue damage causes them to have problems with their joints and connective tissue. But it can be diagnosed in infants because that homogentic acid that accumulates and its breakdown products produces a brown or a black color, which is in the urine, and therefore it stains the diapers of infants. So here is the pathway for alkaptonuria. And on the left, you see the description of this as a disorder in which the enzyme that degrades homogentic acid is deficient. And that enzyme is called homogentisate 1,2-dioxygenase, or HGD. You can see the arrow points to the pathway where homogentic acid is converted into malonyl acetic acid. And of course, homogentic acid itself is a product of 4-hydroxyphenylpyruvic acid, which is a product of tyrosine. So this is part of the tyrosine degradation pathway. And it's stopped at homogentic acid in alkaptonuria. Now, you can see right above that, the pathway above it, the reaction above it, is the conversion of 4-hydroxyphenylpyruvic acid to homogentic acid. And that is blocked by nitisinone. And so one treatment of alkaptonuria would be to not produce so much homogentic acid. And you can do that by giving nitisinone because that blocks the production of homogentic acid. So that's where Harlequin comes from. It's basically nitisinone itself. And of course, the problem in alkaptonuria is that the homogentic acid accumulates and produces breakdown products that turn the connective tissue dark and destroy it.
Important safety information. Indications. Harlequin is indicated for the reduction of urine homogentic acid, HGA, in adult patients with alkaptonuria, AKU. Important safety information. Do not prescribe Harlequin to patients allergic to nitisinone or any other contained ingredients. Warnings and precautions. Ocular symptoms and hyperkeratotic plaques due to elevated plasma tyrosine level. Ocular signs and symptoms including keratitis, corneal opacities, corneal irritation, corneal ulcers, conjunctivitis, eye pain, and photophobia have been reported in patients. Perform slit lamp examination prior to treatment and regularly thereafter. Re-examine patients if symptoms develop or tyrosine levels are greater than 500 micromoles per liter. Assess plasma tyrosine levels in patients with an abrupt change in neurological status. Perform a clinical laboratory assessment, including plasma tyrosine levels, in patients with an abrupt change in neurological status. Leukopenia and severe thrombocytopenia. In clinical trials, patients with hereditary tyrosinemia type 1, HT1, treated with another oral formulation of nitisinone and dietary restriction, developed reversible leukopenia, thrombocytopenia, or both. No patients developed infections or bleeding as a result of the episodes of leukopenia and thrombocytopenia. Monitor platelet and white blood cell counts during Harlequin therapy. Adverse reactions. The most common adverse reactions, greater than or equal to 1%, reported in patients with AKU taking nitisinone in clinical trials are elevated tyrosine levels, thrombocytopenia, and keratitis. Drug interactions. Nitisinone is a moderate CYP2C9 inhibitor and a weak CYP2E1 inducer. Potential clinical impact of Harlequin administration with CYP2C9 substrates. Reduce the dosage of the co-administered drugs metabolized by CYP2C9 by half. Additional dosage adjustments may be needed. Nitisinone is an inhibitor of OAT1/OAT3. Potential clinical impact of administration with OAT1/OAT3 substrates. Patients should be monitored for potential adverse reactions. Use in specific populations. Pregnancy. Limited available data with nitisinone use in pregnant women are not sufficient to determine a drug-associated risk of adverse developmental outcomes. The background risk of major birth defects and miscarriage for the indicated population is unknown. All pregnancies have a background risk of birth defect, loss, or other adverse outcomes. Lactation. The developmental and health benefits of breastfeeding should be considered against the mother's clinical need for Harlequin, along with potential adverse effects on the breastfed infant from Harlequin or from the underlying maternal condition. Pediatric use. The safety and effectiveness of Harlequin have not been established in pediatric patients with AKU. Geriatric use. Insufficient data from clinical studies of Harlequin to determine if patients greater than or equal to 65 years of age respond differently. Elderly patients should be cautious reflecting any decreased hepatic, renal, or cardiac function, and of concomitant disease or other drug therapy. For more detailed information, please refer to the full prescribing information at harlequin.com/PI. To report suspected adverse reactions, contact Cycle Pharmaceuticals at 1-855-831-5413 or the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch.